Hi, welcome. Thank you for joining us. I'm just going to give everyone another minute or two to sign on to the presentation. We'll begin in a few minutes. Well, thank you for joining us to learn a little bit about the graduate psychology programs. My name is Carol Lombardi. I am the Executive Director of Graduate Admissions. Joining me today is the Program Director, Dr. Christina Hallett. Welcome, Christina.
Welcome, glad to be here.
And my colleague, Rashida Thornton, who also works with the graduate psychology programs. As we go throughout the presentation, please don't hesitate to ask questions. You can type them in where the question mark is, and I can address them as we go throughout the presentation. For those that might not be familiar with BayPath, we were established in 1897 as a private not-for-profit. Our main campus is in Longmeadow, Massachusetts, with our Health Science Center in East Longmeadow. We currently have over 3,300 students and more than 21,000 alumni worldwide, and we are accredited by the New England Commission of Higher Education. At the graduate level, students choose BayPath for a variety of reasons, but we are known to be flexible and accessible with our programming, our supportive faculty and staff, and an engaging and diverse community. We have been online since 2006, so it's an area where I believe we've been ahead of the curve. We utilize Canvas as our online learning platform. It is very user-friendly and intuitive. If you were to become a student here, there is a free course that orients you to the new to the Canvas platform. It's accessible from your desktop, tablet, or mobile app. And we also have a dedicated support team should you need it throughout the program. At this time, I'm going to turn the presentation over to Dr. Hallett to go over the actual academic components of the program.
Good evening, everyone, and I'm so glad that you're able to join us and find out a little bit more about our programs. So there's several things on the slides, and I know that you can both read them, and I'm going to add some things that aren't there, as well as not necessarily reading you every single word of a slide, because I don't know, I find that to be a little annoying. I'm betting you do too. What I do want you to understand about our program is that we're really looking to come from both a holistic and an overall generalized understanding of what it means to be a human in terms of social, emotional, intellectual, and physical functioning. We are very, very dedicated to having a faculty, and I think this comes up again later too, who are all practitioners. So every single one of our faculty is working in the field clinically and able to bring that to the classroom. So when you see this bullet of apply advanced theories to practical situations, we're able to draw upon the ongoing and current knowledge of our faculty and integrate that with the theories and the most current research that's going so that you can directly see how that would apply to clinical practice. We truly do have a research focus in terms of the skills that one uses for research. That doesn't mean that you're doing a specific out in the community research project, but what it does mean is that you need to have the skills to be highly literate in going through the professional literature, synthesizing things and understanding what are some of the changes that are coming in mental health. And as you all know, we've been in a mental health crisis, so the changes in mental health practice and best practice and newest practice, those are all fast and furious all the time. We literally will help you focus throughout the program on developing and then cultivating and expanding your clinical skills across the board in all levels of functioning and at all ages. So on the slide, we mentioned mood and anxiety disorders, trauma, and substance use. You'll hear a little bit in a couple minutes about the fact that we also have specific concentrations and ways for you to specialize. So in our clinical mental health counseling program, that's our 60 credit master's program, you will meet all of the education and internship requirements to be able to be licensed in Mass as what's called an LMHC, or a licensed mental health counselor, or in Connecticut, which is called an LPC, or licensed professional counselor. Across the United States, various states use either the LMHC or the LPC, so keep in mind those terms are actually interchangeable. Most states have fairly similar requirements to both Mass and Connecticut. If you're coming from a state other than Mass or Connecticut, that's something that we can help you look into to make sure that you'll meet all the criteria you need in that state. Go ahead. Applicable to diverse settings, man, oh man. So you can go really and work anywhere with the LMHC or the LPC. I'll probably end up saying LMHC in general, just because our main campus is situated in Mass, so that ends up being the language I often use. So if you go through and become licensed as a clinical mental health counselor, you could work in a college mental health center. You could work in a nursing home. You could work in a medical center. You could work in corrections. I've done that. You can ultimately work in private practice once you've done your 2 years postgraduate work. And that's true for all mental health degrees. So that's not specific to BayPath. It's not even specific to the clinical mental health counseling degree. If you were entering a licensed marriage and family therapy or an LMFT program, you would still need to work in the field for pay for 2 years before you'd have an independent license to practice. However, once you have that independent license for any of the mental health specialties, if you want to go into private practice, that's an option. So any place that you can imagine that mental health services are given, those are places where you're potentially able to get a job. Oh, here you see some pictures. That's me on the bottom left. And you see also Professor Liz Beliveau, who's one of our full-time faculty. You'll see Professor Mallory Billow, who is one of our adjuncts, Professor Suzanne Guile. She's actually an LICSW if we're in Massachusetts, and it's an LCSW in Connecticut. These are some of the minor things that happen between states. It's the same level of licensure. So you only see pictures of 4, but if you actually go onto the website, you can see a bunch more pictures of our faculty and get a sense of who they are. As I already mentioned, every single one of our faculty are current practitioners in the field. From my personal perspective, that is the most useful and important thing that we offer that is different from many, many other institutions. None of us have decided to go into just the ivory tower of academia and put our clinical practice behind. Every single one of us is actively doing that clinical practice, which keeps us fresh and having new examples. So we particularly, as you can see, that's bullet 2, we look for people who are competent practitioners. Specifically, we have people who are psychologists, who are social workers, who, as you can see from Mallory, she has her master's in education. We have people who are licensed marriage and family therapists. So we also want to have this integrated model where we're bringing in faculty so that we do have a diverse group in terms of culture, race. We want to have diversity in terms of degrees and orientation. You can see on the slide that we talk about bullying. That's one course, but literally what we're looking at overall is what is healthy development? What does that mean in a community practice? And what are all of the things that you need to know? So, like I said, keep listening so I can talk about our concentrations. That's coming up. So first, I'm going to talk to you about the Master's in Developmental Psychology. And it's important that you understand the difference between these 2 programs. This Master's in Developmental Psychology is 36 credits. This does not allow you to then go and work in the field as a mental health counselor. And that's an important distinction. To go and work doing clinical services requires that you graduate from a 60 credit program. That's our CMHC that's coming. So for the Master's in Developmental Psychology, you can see the variety of courses that you would take. Again, there's the human lifespan development. Everybody's always going to take ethics and professional conduct. We'll look at family systems, psychopathology, counseling and co-occurring, psychological assessment. That's a course I teach in the summer, career development. And then there's just 160 hours of field work. So this gives you a broad range of what the 12 courses are in that 36 credit master's. Here's the fieldwork. It's 160 hours and it's done somewhere in the community. It's not meant to be specifically clinical practice, but it's usually a project that someone is doing within a community organization. And that could be a hospital, it could be a school, and it's really geared towards, you can see this in the last line, the practical application of all of the developmental knowledge that you've gained within those 12 or 11 courses in developmental psychology. It's done at the very end of the program, and along with that, you write a final paper that really brings together changes in the literature with your actual experience that is a supervised but probably not clinical experience in the field. So you can see this is the 60 credit master's. You'll notice that there's a lot more courses. And that's true because this is 20 courses, the 60 credits rather than the 12 courses. Within this, what you'll see are a lot of the same courses, because if you're in the developmental psychology program, all of those courses are embedded in the clinical mental health counseling program, except for fieldwork. The differences have to do with the practicum and the internship. The internship is 600 hours, more on that in the next slide. But there's these core courses, same kinds of things, ethics, human lifespan development, research methods, counseling skills and techniques, but also some differences such as group dynamics and learning how to run groups and spending more time in counseling theories and practice. There's also a much broader range of electives, and you can see all of those electives on the other side of the screen. You'll see in there 4 different courses that are related to trauma, and actually we're not doing, as I noticed this, the bullying course or behavior course anymore. We have now changed that to trauma and crisis intervention. So that's an elective. So there's totally actually 5 courses that are related to trauma, as well as really looking at some other very specific education in substance use and treatment. Here's our concentrations. I kept mentioning them. So we have the advanced trauma-informed counseling, and this is available also as a certificate for people who have already graduated and are working in the field. So if you're coming in right now to get your master's, this is a really, really positive and very cutting edge concentration. You can go through and learn all of the information that is the most recent in trauma practice right now. And as you can imagine, that's a big area for all of us. And that's going to continue to be, as the need for mental health is going to continue. And that's probably our single biggest concentration of the concentrations. Now, when we say concentration, we also mean you're still getting the master's in clinical mental health counseling, that's 60 credit master's. But you're taking certain sets of courses so that you have then a concentration. So the advanced trauma-informed counseling. The next one is a school adjustment counselor. That is our second most popular concentration. They're not listed in that order on purpose. It just happens to be a lot of people are really interested in working as a school adjustment counselor. Now, this only applies specifically to Massachusetts. We are licensed through DESE, the Department of Education Services in Massachusetts, to help people meet specifically, again, the educational and practice criteria for Massachusetts school adjustment counseling. This may also apply in other states as well, and that's one of those things that, again, we would help you negotiate and understand. And then our third counseling is the alcohol and drug abuse counseling concentration, and the CADAC is what we say. That's the Certified Alcohol and Drug Abuse Counselor. That is a national thing that is in every single state in our country. And if you are in that concentration, you would do your 600 hours of internship, specifically in a primary substance use treatment place. You take certain courses, and that would help you to have met all of the educational criteria to then apply for and get the KDAC. And the KDAC, again, requires 2 years of working after you graduate, because everything is done 2 years after you graduate, but you would have met all the educational criteria through that. So the practicum, which is typically, depending on how many courses you're taking at a time, we think of this as second year or beginning of second year, depending on if you're going full-time or part-time. It's 100 hours. It's a seminar class. It's done within BayPath. So even though all of our courses are online, we also have a professional license for Zoom that is HIPAA compliant. And so you will do counseling and practice counseling over Zoom, which also teaches you about telehealth. Definitely something that's going to come up in your future clinical practice if that's the road that you're going down. So we do that all within BayPath, and you have individual supervision and group supervision and this counseling practice. And once you complete, you have to have done at least 24 credits in the program. That's 8 courses. And then you can take practicum. And once you've taken practicum, you're then potentially eligible for internship. Here you go, internship. We've broken it down into 3 different courses that equate to about 200 hours per course. So the internship is an entire 600 hours of clinical practice with your working in the community somewhere. And right now I have a list of 36 different sites that students this summer are going into starting in the fall. And we have an entire list that probably has hundreds of potential sites where people have done their internship in the past. Now, what's important to understand is it's 600 hours. It is in an agency. You are doing clinical services. It's called a second year internship so that outside people can understand that. And really what that means is that you're now at a point where you're literally learning and working in a hospital, in an outpatient mental health clinic, in a rehab center, in some literal clinical internship. So the first 200 hours is where you're learning what's going on in the site. At this point, pretty much everybody uses electronic medical records. So you'll learn that organization's electronic record keeping system. You will have, of course, ongoing individual and group supervision. And this is really where you get to learn the site, who it is, the clientele that they're serving, and the associated paperwork and responsibilities. In internship 2, which is basically hours 201 to 400, and you're doing them continuously, even though you sign up for them as different courses. At this point, you're really hitting your stride. You know what you're doing. You're continuing to see clients on a regular basis. You're doing assessments. You work on differential diagnosis. There's treatment plans. There's discharges. You're now doing the full role of a master's level mental health clinician. In the final section, the last 200 hours from 401 to 600, you continue in the same setting. You're still working with clients, often more intensive need clients. You're working with a greater degree of autonomy while you're still under supervision. By the end of this, at that 600 hours point, you are ready to go out, graduate, and work in a job in the field. And in most states now, there's what we call an initial practice license. So once you graduate, you're able to get that initial practice license, and you work collecting your next 2 years of hours under that, and then you can move up to and apply for the full independent level of licensure. So, schedule. I say to people that there are 3 things that I think are the best things that we offer that really make us stand out. So one, as I've already mentioned several times, is the fact that every single one of our faculty, full-time or adjunct, are practitioners. That's a big standout. The second thing is the quality of education. I truly believe that we have a high quality education. We're sort of high touch, supporting people, and I'm regularly in contact with people who have graduated from our program. In fact, I will tell you that this summer, 4 new adjuncts came on to teach in the program, all of whom are graduates from our program. We already had a bunch of graduates from the program who've been in the field and are now coming back and teaching while they still work in the field. But the third thing that really makes us stand out is flexibility. So when this slide says convenient schedule, you literally, you are in charge of your own destiny. You can start in June, September, or January. You can take 1 class at a time, 2, 3, or 4 classes at a time, depending on what fits your life. You do need to take at least 1 class per semester. That's a financial aid requirement. We are in a calendar reorganization period, but so the fall courses will start September 11th and end December 21st. And then our next set of classes, because we have 3 trimesters, will begin January 16th, 2024. So you can finish, when we look at the developmental psychology, the 36 credit masters, you can do that all in a year if you're going full time, or you could do it in 2 years. With the clinical mental health counseling, the 60 credit program, you can do it full time and finish it all in 2 years, or you can space it out, take fewer classes per semester, and finish anywhere between 2 and 4 years. So when I say flexibility, I mean flexibility. You can start anytime. We have schedules already prepared for you that, and Carol knows this, we have schedules that say, oh, fall start, trauma concentration, part-time. We also have spring start, trauma concentration, full-time. Every single concentration, every single time, whatever it is, we've already figured out a way to help and guide you through that. And that's why I think this is such an important thing that we offer.
I can take over. The Student Financial Services Department is a fantastic resource. They are experts at what they do. So if you intend to apply for financial aid, please be aware that they do host monthly webinars on how to pay for graduate school. They have what they call Fast for Fridays, where you can get live help filing your financial aid application. They are available by phone, by email, and also by appointment. So please don't hesitate to reach out to them with any questions about the financial aid process. Stafford loans are available up to $20,500 per year, and they are a great resource. The application process is very straightforward. We have an online application, and we require all official transcripts from your undergraduate institution and/or any graduate work you've done, an essay, current resume, 2 recommendations. We do have a form for that, and a signed program requirements form. Again, we have a form for that. So it's a very straightforward process. I'm putting up contact information for the 3 of us, but we would love to open this to questions. So all you have to do is type it in where the question mark is, and I can read it off.
So I also have a question for all of you while you take your time typing in yours. So Carol tells me that there are some of our faculty who they'll do this. Sometimes it's me, sometimes it's one of our other faculty. And we have other faculty where people are asking questions all along. And I'm really curious because often people don't ask me questions until the end. And now tonight I'm thinking, is it because I talk too fast? Could it be that I'm talking too fast? Or am I giving you so much information as we go along? They're like, wait, I need to catch my breath. So if you haven't thought of another question now, that is another question that you could answer on my behalf.
Oh, that's interesting. I'll let you know if we get any responses to that. So could you discuss the components to licensure?
Yes, and I'm going to talk specifically, it is the same process, whether it's basically going through a School of Social Work or clinical mental health counseling. So I'm going to talk about clinical mental health counseling, but when you have a master's, it's in essence the same process across degrees. So first thing you do is you complete, like this, a 60 credit master's program in clinical mental health counseling. As part of that, you get 700 hours of work, which is the 100 hours of practicum and the 600 hours of internship, which is direct client contact. As soon as you graduate, you are eligible to apply, and this really only involves a transcript and a verification form from the school. You're able to apply what, I'll use Connecticut, they now have, and Massachusetts is about to, Connecticut now has an LPCA, which means Licensed Professional Counselor Associate. Massachusetts is about to add the LMHCA, which would mean Licensed Clinical Mental Health Counselor Associate. And they're wanting to do this two-step licensure process to make it consistent, because that is what happens in social work and many other states. So you graduate, you take a national exam. We offer a training course on the exam, and we currently offer it both in the spring and in the fall to people who are about to graduate or who have already graduated. It's a licensure exam prep course. So you do the 60 credit program, you attend a licensure prep course, you take the national exam, you apply for the associate's license, and that only involves transcript and school verification. And then you get a job in the field where you are paid equivalent to a master's level clinician, and you work wherever the setting is that you want to work in. So potentially you're a master's level clinician on an inpatient psychiatric unit, or potentially you're working in a community mental health center. In the Western Mass area, that might be something like BHN, the Behavioral Health Network, or CHD, Center for Human Development. You work there over the course of 2 years, being paid as a regular employee, and you continue to be supervised. So you accumulate all of your needed supervision hours, and then at the end of the 2 years, and it's really based on 3,000 hours that you need to accumulate post-graduation. However, you are limited in how many hours a week you can do. So in essence, the 3,000 hours really takes 2 years to complete. So you do that, you then apply for your independent licensure. You send in an application that has verification of your postgraduate 3,000 hours and supervision. The licensure department, the Board of Examiners reads it, they say, yay, good for you, and they send you back your license. You can now continue working where you're working, or do that and open a private practice, or go to another place. At that point, when people are independently licensed, they do often earn a little bit more than with the associate license, because the independent licensed person is now able to supervise other people.
Thank you. Can I do my internship in different locations?
We really encourage people to do all 600 hours in one place. And specifically, that is because it takes time to get familiar with the agency and the way that the work is done there. And it's also really skill-based growth over time. There have been a few cases where people have split half and half, doing half hours in one setting and half in another. But truthfully, sites don't really like to do that. Sites prefer to have someone who can learn and grow with them. I can tell you, however, that an extraordinarily high percentage, it's well over 80% of our students are offered a job at their internship site once they finish and graduate. And that's part of the reason. So if you did, let's say, 200 hours in one place and then just 400 in another place, you wouldn't be as proficient in your work or the setting as if you had done it all in one place.
Do you help finding an internship location?
Students are responsible for finding their own internship location, but we've set up a whole bunch of different things to help students with that. So there is a class on the Canvas platform that we mentioned earlier, and it's called Graduate Psychology. In that class, there are, and it's not an actual class, but it's a place that you go to find all this documentation, all of those different schedules and concentrations that I mentioned. It also has links to the licensure applications, etc. And it has a list of all of the places where we have had students do internships in the last 10 years. Could be more than, probably more than 10 at this point. And so those are examples of where you could potentially look. So we have people, not just in Mass and Connecticut, we have people from all over the country, including California. So sometimes that means the person is looking in their own home state and their own home area. Once you identify a potential site, that information is forwarded to our Director of Clinical Training. And at that point, we look through, we check to make sure that the state licensure requirements are met by the internship site and that it's appropriate. And then we support the student in creating the necessary documentation from our end that allows them to do their placement there. We also have, so if you were going to enter this fall and you were full-time, as an example, we will have one more year. We're starting year 3, so we have one more year after this of a grant from the federal government, and that allows us to give, during that last year, we will be giving 35 of our students a $10,000 stipend towards their expenses while they're doing their internship, because internship is typically, generally speaking, done during the day. There are ways for people to get evening and weekend hours for internship as well. We're also continuously looking into other grants and opportunities so that we can help support students with funding during the time of their internship.
Great, thank you. I think you touched upon this, but what is the job outlook for licensed mental health counselors?
It's phenomenal. And I'm laughing. I shouldn't laugh, right? It's not good that the whole world is in a mental health crisis, but this is a very, very growth-oriented profession. We are desperately in need of more and more mental health clinicians to work in the field. I can tell you, I have my own small private practice. I am not able to take new people in, but I get calls every single day. Every organization is looking to develop the workforce. So the federal government, Massachusetts, Connecticut, every place that I've encountered is looking to increase the workforce for mental health clinicians. It just because of, even before COVID, this was true, people just weren't talking about it. But certainly since COVID, we've seen the need and the acknowledged need for mental health services skyrocket. That is not going to be changing anytime soon. The reality is that there's a lot that's really difficult and challenging about living and trying to get to thriving and dealing with challenges along the way. So I think that statistics say it's something like, oh, Carol, you might know better than me. I think it's 22% projected job growth over the next.
It is 22%.
Right.
Yep.
So
through 31.
It's higher than anything.
Yes, it's huge. If I get my license in Massachusetts, but then move to another state, will I be licensed in that state?
So some states make it slightly easier and some sort of neutrally easy. Generally speaking, you can get reciprocity. So it means if you're licensed in Mass and then you move to Rhode Island, you simply submit all the materials again. You've already passed the national exam. And then because you've been licensed, sometimes they call it reciprocity, sometimes they call it endorsement, but then you're able to get licensed in that next state. We do suggest to people, and I'll give you a specific example. We suggest to people, if you already know where you might want to go in your life to live, and let's pretend you currently live in Mass, but you think you want to go live in Florida, as an example. I happen to know that Florida requires a course in human sexuality. Mass does not require that. Connecticut requires a course in career development. So we have all of those courses available. And if you're thinking, hey, I might want to live here or there, that's an opportunity to talk about with your advisor, look at what the criteria are, if there are any specific criteria in other future states, and just make sure you take that coursework while you're doing your program. The truth of the matter is, changing state licensures is more, it is a formality. It takes a little time because state agencies are reviewing your material and you have to pay, but it's not difficult.
Thank you. Could you speak to the difference between an LMHC and an LICSW?
So an LICSW is a licensed independent clinical social worker. That means that they did a 60 credit hour master's degree in social work at a school for social work, compared to the LMHC, who is a licensed clinical mental health counselor who did a 60 credit master's program in a clinical mental health counseling master's program. Individual programs may have a slightly different focus. So for example, I know that there are social work schools who specifically focus on issues of social justice. There are other social work schools that really focus more on being an administrator rather than a clinician. There's some other social work schools that focus on group work. Our program, as you see from our concentrations, is very, very focused on teaching people and preparing practitioners in dealing with trauma-informed treatment. Whether or not they're doing the actual treatment of those with trauma, so there's two things. There's an approach to treatment that is called trauma-informed, which takes into consideration the traumas that people have likely experienced. And then there's actual trauma treatment, which is working with those who themselves have experienced trauma. That's part of the stuff that I do in my private practice. It used to be that social workers could work in the VA, the Veterans Administration System, and clinical mental health counselors couldn't. As of January 1, 2024, that will no longer be true. From that point forward, the only difference between the two degrees will be what school did you go to in terms of what are their courses, their concentrations, or their overall sort of attitude, approach, right? What are they known for? Other than that, from a functional job basis, effective January 1st, 2024, there will be no difference.
Thank you. Is it possible to do this program while working full-time?
Almost every single one of our students is working full-time, and an equal amount, probably all the same people, are also taking care of family, whether that's parents, children, others. Our average student is working full-time and has a rich personal life of some sort. So yes, it absolutely is possible. And that's where I go back to that flexibility. And I say, what's great is you could take one course at a time. Or if there's a time when things are quieter, maybe you're taking 2 or 3 courses in that semester, but less in another semester. It is truly doable.
Thank you. Do you typically have textbooks or digital resources, or a combination?
It's a combination. So all of our classes, as I said, are online. What we've tried to do is get as many free open educational access resources as possible in all of our classes. And I'll give you an example as well. The DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, that's something that's available to all of our students for free online through the Hatch Library. So you do not need to buy, I want to say it's like $139. You don't need to buy that unless you want to have your own physical copy. Other than that, it's available for you online. We have worked to have our courses, as I said, have as low cost as possible in textbooks, and have texts that we use be available both in digital and physical book format. So some are ebooks that are rentable, others are buyable through our bookshop on campus, which you can order online. You don't need to go to campus to do that. So it really depends on the class. I can tell you that for my assessment class this summer, everything that they are using, we do have a text. It's an online text that they're able to access. And I have put in the course an awful lot of videos and articles and things like that. So it's not just go read the text and teach yourself, right? The point of our having these classes is that we've got lots of information that we're bringing together and putting forward for you, not just basically teaching out of a textbook.
Thanks. And typically, how big are the online classes?
I have asked that all of our online classes be capped at 22. Again, I'll use my assessment class for the summer. We have that capped at 18 because people are learning how to use assessment tools and measures that you will use in your clinical practice. Our practicum and internship classes are all capped at 10.
Great, thank you. And am I able to do 2 concentrations?
It's very difficult, and it depends which ones. In rare circumstances, and it ultimately involves probably paying for one additional course over the 60. You can do the alcohol and drug abuse counseling concentration, and then as your additional electives, take 3 of the 4 trauma classes, and then you would take 1 more, so you'd have 63 credits at the end rather than 60 to have the trauma. So because it's a standalone certificate, you can then have the trauma certificate and the alcohol and drug abuse counseling concentration. I don't recommend that because if you do that, that means you cannot take other classes that, generally speaking, would be beneficial for licensure in other states. So for example, I mentioned career development. If you're ever going to live in Connecticut, you need to have taken career development. There's several other states where that is also true. I actually think Florida is one of them, whereas Massachusetts does not require that. So I try to help people take all of the potential electives that they would need in order to be licensed wherever they may want to live. So technically you cannot combine the school adjustment counselor with any other concentration because DESE has dictated a very specific course schedule that we cannot deviate from.
Thank you. So there are no more questions at this time. So I do want to invite everyone, if you have a question, to type it in and would be happy to read it. While we wait, is there anything you'd like to say, Christina?
Well, first of all, come on. How come none of you answered my question about why no questions when we went through this? What I will say is this. I'll tell you another thing that we do, and in all of our classes now, and it's just something that I think really makes a difference. So we offer several optional synchronous meeting times online. And I mention this because I just did a class on Tuesday night with my assessment students. And so the way that I did this, if you're familiar with online classes, there's often you'll do a primary discussion post for a week and then respond to 2 of your classmates' own initial post. So what I say is, here's an optional class that you can attend from, this one was from 6:30 to 7:30. Sign in. If you do, you will get credit and you will not need to do your 2 peer responses. So it gives us a chance to talk live, even though it's through the computer, get to know each other, ask all sorts of questions, and be available. The student has a benefit because they only have to do their initial discussion post. They don't have to do the 2 peer responses. But they're also working on developing a sense of connection and community with both their professor and the other students in their class. And we try to do this in all of our classes. I also, because I've gotten permission, record that and I make that available to anyone who wasn't able to attend, just so if they want to hear any of the questions that people asked when they couldn't be there, then they have that as an option. and that to me exemplifies one of the things that I've mentioned that I think is really special and different about our program. It's not just that we're practitioners, but it's also every one of us is truly committed to the education and cultivation of new clinicians. So all of our faculty are really engaged, they're really involved, they reach out to students, students reach out to them, and it's, I believe, a truly very supportive environment because we're here for you to learn, grow, master the skills, and succeed.
Great, thank you. So there are no additional questions. So first, I want to thank you, Dr. Hallett, for the presentation. It was fantastic, and it's always a pleasure to work with you. And I'd like to thank everyone for attending this evening, taking time out of their schedule to learn about our programs in developmental psychology and clinical mental health counseling. This will be sent out to everyone, so you have the information, but please don't hesitate to contact any of us, myself, Rashida, Dr. Hallett. We'd be happy to assist. So please, I hope everyone has a wonderful evening, and thank you. And do you have any final comments, Dr. Hallett?
Yeah, I just wanted to say thank you all really for taking the time. Truly, it is okay to reach out to any of us, and we hope that you do because we like to answer your questions and we want you to make the choice that feels like the right fit for you. So hopefully you'll be in touch and have a great evening.
Thank you. Have a great night, everyone.